It's 8:15 a.m. in Ward 5H at Royal Perth Hospital. Ben Marchant is getting ready for radical surgery that could change his life forever.
I just hope this surgery gives me my lifestyle and then my life back.
Ben suffered from epilepsy, ruling his life for 7 years. He can have up to 7 seizures a week and needs 40 tablets every day.
Well, I've been out of work for 3 months, generally due to the side effects of the medication. I find it hard to concentrate, a lot of fatigue due to the side effects of the medication, tremors.
This morning we joined the neurosurgery team at RPH with the 28-year-old only moments from delicate brain surgery.
A little bit nervous, I think. It's only half an hour away.
So delicate, the specialists will remove part of his brain to stop the epilepsy, and Ben will be awake while they do it. For Ben, it's a calculated risk.
There's probably about an 80% chance of curing his seizures if I can successfully remove that area of scarring, whereas there's probably about a less than 5% chance of curing his seizures with another medication.
Open your eyes for us, it's Dr. Miles.
It's Andrew right there.
Perth neurosurgeon Andrew Miles has performed only a handful of these operations. This is the first time a television crew's been allowed to film this extraordinary procedure. What's happening behind me is that surgeon Andrew Miles is cutting out the part of Ben's brain that's causing the epilepsy. He's taking out a 4 or 5 centimetre slice. It's a sensitive spot because it's the part of Ben's brain that controls his speech, and doctors have to keep him conscious to monitor his language.
Right. Screwdriver.
Ben is shown different pictures on a computer. He's awake, and with part of his skull removed and his brain exposed, he can actually speak.
Nice and loud, Ben. Keep it going.
Cow. Truck.
Although we want to remove as much of his epileptic brain as possible, what we don't want to do is damage part of the brain which controls language. So what we do is wake him up and we ask him to do some language testing.
Can you actually feel anything, Ben?
Someone's squeezing my toes.
How about the other end of your body? How about your head? Can you feel anything at all?
I can feel quite a bit of a sensation in my brain, but no pain.
How did he go?
He did very well. He's done very well, as you saw before. He's successfully completed the naming testing, and at the same time we're recording his electrical activity from the brain, and that'll enable us to sort of localise closely where the seizures are coming from.
With carefully calculated anaesthetic, Ben's put back to sleep, and now they'll remove part of the brain.
A lot of my patients ask me, what is the chance of dying? And in fact, you're more likely to die from an uncontrolled seizure than you are from neurosurgery.
It may take up to a year to tell if Ben's operation has been successful. It's hoped that thousands of others may benefit from the same technique.
In anyone who has epilepsy that is difficult to control with medications, there's the balance of the risks of surgery versus the risks of having continued uncontrolled seizures and the risks of the side effects of the drugs. And when you weigh up the balance of the risks of surgery, it actually comes up much better, much more in favour of surgery.
For Ben, the risk is worth it, and the surgery quite an experience.
I could do with a beer.
Really?
I'm a bit dry in the mouth.